Thanks for being here today, everyone. Premier Mo will have an open comment about the provincial state of emergency, and then we'll open it up to questions. Premier Mo.
Good. Well, good afternoon, everyone, and thank you for being here today. Today, the government of Saskatchewan has declared a provincial state of emergency, giving the government broad powers to address the COVID-19 pandemic. This is a responsibility that we take incredibly seriously and a decision that we do not take lightly. The declaration of a provincial state of emergency provides our government with powers that include the ability to limit travel to or from a community or a region of the province and directing that a property or equipment can be deployed to address the COVID-19 pandemic that we are facing. The decision to declare this provincial state of emergency comes following confirmation from the Chief Medical Officer that Saskatchewan has 8 new presumptive cases of COVID-19, and this decision comes on Dr. Shahab's advice. This brings Saskatchewan's total of presumptive and confirmed cases of COVID-19 to 16 cases across the province. And Dr. Shahab will have more to say about that in a moment. Additionally, the government, in consultation with the Chief Medical Health Officer, is imposing a number of new restrictions to reduce the risk to Saskatchewan people, to prevent transmission of COVID-19 and to ensure that acute care services are preserved for residents that are most at risk for severe illness. So the following measures are effective immediately. Public gatherings larger than 50 people are prohibited. All restaurants, bars, and event venues must limit their seating to 50% of their capacity or up to a maximum of 50 people, whichever is less. All must be able to ensure social distance of 1 to 2 meters between the customers. Retail spaces, including grocery stores, pharmacies, gas stations, will be exempt from this policy. And I would also note that this is phase 1 with regards to bars and restaurants, and we may implement phase 2 in the coming days, which would be closing them completely, except for takeout and delivery options. All gyms, fitness centers, casinos, bingo halls are all ordered to close until further notice. Residents are advised to limit any non-essential travel outside of the province of Saskatchewan, with the exception of people who live in border communities and are commuting for work. All Crown utilities will implement an interest deferral program for up to 6 months for Saskatchewan residents who are unable to make bill payments due to the impacts of COVID-19 restrictions. And all government of Saskatchewan ministries, agencies, and Crown corporations will implement a phased-in work-from-home policy that will become effective on Monday, March the 23rd. This is applicable to employees that are deemed non-essential, and this means that any employees that are able to work from home will be able to do so while providing managers a period of time to ensure that we have workforce continuity. The Saskatchewan Health Authority will be discontinuing all non-urgent elective surgeries and procedures and diagnostics as of March 23rd. This action will allow the Saskatchewan Health Authority the ability to redeploy nurses and other staff to ensure that medical supplies and personal protective equipment are available when needed, and to reduce the risk of further exposure to not only our healthcare providers but our patients. The Saskatchewan Health Authority will continue to provide services to patients who require emergent and urgent care. Cancer, urgent and emergent surgeries will continue as planned, and patients will be contacted regarding their scheduled services. Finally, parents with children in daycare should also be preparing for the potential for further restrictions in the days ahead. And I want to conclude by saying this to the people of this great province. We will get through this, and we will get through this together. But we all have a responsibility, and we all have to take that personal responsibility seriously. And I would say that most of us are doing that. But I have heard some anecdotal reports of people that have returned home from abroad and who are out in the community the very next day. And we just simply can't do that. We need to self-isolate. And I know you may say that you're feeling just fine, but you might be endangering the health and the lives of others. Your neighbor possibly, or even an elderly family member. And I know this is completely counterintuitive, especially here in our province. In times of crisis, we are a community and we pull together as one. We've shown that so many times. But today, pulling together means we need to stay apart. It means taking extra precautions like washing your hands more often than you otherwise might, and practicing social distancing. It means self-isolating for 14 days when you return from international travel, and that is so important. If you are feeling healthy and you haven't been traveling or you haven't been exposed to someone who has tested positive, I would offer you this. You can help by delivering groceries to a friend, to a neighbor, or to a grandparent who may be self-isolating on their own. We need to look after one another. It means buying what we need at grocery stores and not hoarding. And I will repeat precisely what I said the other day. COVID-19 will not cause shortages in our grocery stores, but hoarding will. So don't do it. But most importantly, helping each other out during this pandemic, it means listening to Dr. Shahab and his advice that he provides, as well as his counterparts, public health officials from across Canada. And this means each and every one of us should adhere to the advice that they provide us. We are taking action in this province on the very best advice from some of the very best medical professionals in the world, but it simply will not work if we do not follow it, each of us. It's important for us to understand that these measures will not completely prevent the spread of COVID-19, but they will flatten the curve. And it's only together, if we take this situation seriously. And that's what I'm asking each and every resident of this province to do, is to take this situation very seriously. As individuals, we all have a personal responsibility to ourselves, to our family, to our community. We have a personal responsibility to this province and to this nation. In closing, I would just like to thank each and every worker that is providing an essential service in Saskatchewan today. Doctors, nurses, healthcare technicians, paramedics, police officers, and firefighters. The work that you do, it's of the utmost importance each and every day, but I think it's even more impactful during this time of tremendous uncertainty. And to the truck drivers and the grocery retailers and the pharmacists and all that are playing a critical part in our supply chain and our communities, thank you for keeping our shelves stocked, and thank you for keeping our fridges full and our families fed. And to all of the people in this great province of Saskatchewan, I would say this: we will get through this, and we will get through this together. Thank you. We'll take any questions that may be.
Why did you wait until after the spending plan was released and this morning's activities went forward before declaring this state of emergency and informing us of this information?
The two times aren't connected. These are separate initiatives, separate conversations that are happening. This is the time that we do the update with respect to coronavirus, and so this is the time that we're moving forward with on the advice of our Chief Medical Health Officer.
When did you receive that advice?
We've been working on it throughout today, I suppose.
Well, yesterday when I was here, I was saying that we should not be surprised to see an increase in cases, primarily due to travel, and we should expect to see community transmission. So that was around 3 p.m. when I was here, 2 p.m. And then in the evening, we saw 8 additional cases. So our cases have doubled in a day, but they're all travel-related. So we are seeing exactly what we predicted we would see. It's happening pretty fast, but it's still something that is manageable. But at the same time, like the Premier said, we are going to see a lot of people coming back, both short-term visitors and long-term travelers coming back. It is essential now that everyone who comes back self-isolates for 2 weeks, because we want to minimize any chance of community transmission. Having said that, we will see community transmission. We will try to control that as well as we can, and that is the purpose of, that should be all the goal of all of us for the next few weeks, to really, stay at home if you don't have to be out and about. Our children are home, university students are home. If you have an essential service, you go to work and come home. We should all go and buy what we need, and just that, and come home. So I think it is a time to, hunker down, and just calm everything down for a while, and hopefully that will slow any risk of this taking off more quickly than it should.
What's the risk for community transmission now? Is it remain low, or what's it changed to?
In the initial stages, it is very easy to do case contact follow-up. Now, as more and more people come back, it's harder to stay ahead. And as you know, several flights have been notified. Airlines have notified flights where people are traveling back from some destinations, others. So obviously, the case contact follow-up is continuing, but we already know that in many jurisdictions, it is hard to keep up. So that is why it becomes everyone's responsibility. This is not something that someone can police. It's all our responsibility to stay home when we come back from travel, to stay home if we're sick. And then it's the responsibility of friends, neighbors, family to not invite you out if you just come back, but to support you, to greet you from a distance, to help you with your needs, to run errands. And I think that's what we need to do for the next few weeks.
Arthur, next question.
Can you talk about how successful you've been in identifying and reaching the contacts of these new cases? How many have you identified? How many do you believe might still be out there? And what are they being asked to do? Are they being asked to self-isolate, to self-monitor? Are they being tested? What is being done with those contacts?
So as of yesterday, it has been successful, but it is going to become challenging. The advice is that when public health contacts an individual who has become ill, that track their entire movements during the time that they were symptomatic, and then they determine who was a close contact. So close contacts are requested to self-isolate. People who may not have been close contacts are requested to monitor for 2 weeks. So as an example of the airline flights, once we get the information of seat rows, we will contact people who were 3 seats ahead, 3 seats behind. They are not considered close contacts, but they are informed to self-isolate. But others in the plane are informed that self-monitor, your risk is lower, but just be aware. But as this time goes on, I think that becomes less and less important, because now anyone traveling from some destinations, 2 weeks ago, that wasn't the issue. 3 weeks ago, travel from the US wasn't an issue. 2 weeks ago, travel from the US became concerning. Last week, we've seen several importations from some destinations that weren't reporting any cases and still may not be. So I think now is the time that any travel from outside, self-isolate, and even travel within Canada now, we are hearing from our colleagues across the provinces that community transmission has been established in several provinces. We will see that established. This, like the Premier said, is not something that we can prevent totally, but we have to do everything we can that we break the chain of transmission every opportunity we get.
Just a follow-up question. I'm hearing that in one of these cases, I don't know which one, and I'm not asking you to provide any identifying information, the patient was in a doctor's office for an extended period of time and had been demonstrating symptoms within that doctor's office. Are you aware of that? Can you confirm that's the case? How many contacts may there have been, and what are you doing to contain that?
So, and that is an essential point for us to remember at all times, that the ideal situation is that if you've traveled or otherwise you have a fever, cough, you call Healthline, and if you have to see your primary care provider, you call ahead. If you have to call EMS to go to an ER, you call ahead, so that the staff are ready to receive you, put you in your side room. Don't show up without calling ahead. If you do show up, the staff will offer you a mask, put you in a side room. We want to minimize the situation where someone is coughing and waits in a waiting room, but that has happened in a few instances. That results in a larger number of people being told to self-isolate, including healthcare providers. And it is a significant impact for healthcare providers who weren't expecting you. So, healthcare providers aren't wearing a mask all the time. But if you have a cough and fever and you call ahead, then they'll put on the appropriate PPE. So yes, that is happening, and that is why it's important that every person be aware of what their responsibilities are before going to seek care.
And just two super quick clarifying questions. One, you said earlier that all of the cases have been connected to travel, but it says in the press release that one, you have not demonstrated a definitive contact to travel.
So,
can you confirm that?
Yeah.
And secondly, are these contacts being tested?
So all the cases have been linked to travel or a household contact of travel, and that's in most cases it's travel to places outside of Canada, but in 2 instances it's travel to a large conference. Secondly, I think that's a really important point. If you are a close household contact, we have to remember that 15 out of the 16 cases are doing fine in the home setting. Other people in the household can safely stay at home. Most people, if they follow basic precautions, don't get sick from exposure even in the home setting. But if you are a household contact, you also have to stay home for 2 weeks. Once your 2 weeks are over, you are cleared. And many cases also within a day or two, if within about 10 days of symptom onset, clear the virus and are free. So people are going to be clearing this for the most part within 2 weeks of becoming sick, and their household members will also be clear. So in a week or two, we'll already see people emerging on the other end and their contacts emerging on the other end. Contacts, as long as they remain well, and the vast majority do remain well, need to self-isolate, don't need testing. But if they develop fever, cough, they should be tested. But because they're staying home, they hopefully will not have no further contacts. So I think that's why we need to break the chains of transmission, and this is the way to do it.
Jeff?
Yeah, I've been told that a patient in Saskatoon who had been undergoing surgery tested positive, and that now his or her surgical team has been put on isolation. And I'm wondering if you can tell me anything about that.
So I don't have that information, and we usually don't get information where someone has symptoms. If there's a concern that, because many people may develop symptoms and then they are tested, and once the test is reported, then public health confirms the test, the clinician confirms the test. So I have not heard of this instance.
So my story was that it was a person who had, subsequently tested positive. So I would assume that it would be one, A, that you know about, and B, you would have done some contact tracing on.
So I have not heard of this particular instance, but obviously, if this is the case, we will hear shortly.
Just to follow, so can you tell me, so I've been following the news in other jurisdictions where they've been able to talk about, so here's the number of beds that we have available. Here's the number of critical care beds that we have available. So I'm looking for, can you tell me what the range is of possibly, how, realistically, how prepared are we if this thing ends up being what it's predicted to be, say 20%, 30% of the province infected, and the death rate is as we've seen it.
Yeah.
So can you,
Yeah.
I get it's
Yeah.
a little bit speculative,
Yeah.
we don't know for sure.
Yeah.
Other jurisdictions have been providing this information.
Yeah.
I think it would be important for Saskatchewan.
So that's a really important point, and you're absolutely right that over the course of 12 to 18 months, 30 to 70% of us will get COVID-19. But that's exactly the point of all these social distancing measures, because if all of us get exposed within 1 to 3 months, as happened in Wuhan, because they didn't know the virus. It started in end of November in Wuhan. They only caught on to it being a novel virus end of December. So by that time, it was established community transmission. They couldn't get ahead of the curve. And a similar thing happened in northern Italy, where community transmission, it didn't happen by identifying a traveler. It happened by rapid takeoff of community transmission in a population in northern Italy that was primarily elderly. That is exactly what we want to avoid. And what that does is that if all of us get exposed over 12 to 18 months, 80% will get a mild illness, 20% will require some level of hospital care, maybe a week, maybe longer, oxygen and supportive care, or if antivirals are available, those can be given. If vaccine is available by 8 to 12 months, that will be given to further reduce, flatten the curve. And about 2% will require ICU care, 2 to 5% of all people who get exposed. But as long as all those pressures come slowly over 8 to 12 months, the health system still needs to expand its surge capacity, maybe by 50%, but it can manage. If we don't do social distancing, no health system in the world can manage. And I think that's a critical point. And this is not up to the health system to manage. They can manage as long as the rest of us can flatten the curve. If the rest of us can't flatten the curve, no health system in the world can manage.
Next question, Britton.
Oh yeah, I'm just wondering, when was the last time, if ever, the province has declared a state of emergency?
I'm not aware of a provincial state of emergency. There has been community states of emergency during times of flood or forest fire, things of that nature, multiple community emergencies. I'm not aware off the top of my head when the last time the province proper has declared a state of emergency, and I would hope that lends itself to the importance of what Dr. Shahab has been talking about with respect to how our health system will be able to manage what is coming at Saskatchewan. The only way we manage that is by flattening the curve. There is no health system in the world that can manage this virus if we are not able to practice personal distancing, social distancing, if we're not able to flatten the curve in some way.
Next question, Karen.
When you talk about capacity, I'm wondering about facilities we might use. Like, could we see old schools, things like that pressed into service for facilities?
So those assessments that were done in 2009 and never required. So in 2009, all those assessments were done. Now they are being revised and almost finalized, especially COVID-19. And that's exactly the point, that if required, how do you bring online more acute care beds? How do you bring online more alternate levels of care for people who just need support that they can't get at home? For example, if there's 2 people in the house, both are ill and require some level of support, can they be cohorted in a place that's not a hospital, but it could be a school or something? And those were all plans that were made in 2009, were made even before that. They were not needed in 2009, and that was really good. We hope we don't need them this time around, but those plans are being refreshed.
And to the Premier, I'm just wondering if we could get a reaction to this morning's announcement from the Prime Minister, the aid package.
Right, very, very positive announcement from our federal government. Literally billions of dollars invested, I would say, in a very, very effective and positive manner. A large amount of money that is going to be made available to individuals very quickly, and it's going to be made available to individuals that I would put forward require it. They've shortened or eliminated the wait time for employment insurance. They have addressed those that don't qualify for employment insurance, so single person businesses that are operating, accountants, plumbers, electricians, things of that nature. They have provided funding for those that are remaining at home from work to take care of a family member that is ill. They have provided funding for parents that need to remain at home and take care of their children. They've provided funding for businesses to invest in retaining their employees. This is what I think is, many may talk about the size of the package. I would say that it's an appropriate size for this point of time. We can continue to talk to see how long this goes on to, but I would say it's an appropriate size for today, and it is very, very well targeted to those that require it. We are now actively looking if there are opportunities for the province to dovetail into that in any way as to provide further supports if necessary.
Could I just would that include something like federal provincial student loans?
We're Well, what we've done here today is with our utility bills, have provided an interest-free area. We know there's some people that, may have some challenges paying some of their utility bills over the next number of months, and we don't want them to be saddled with any interest costs on that. They also won't be disconnected over the course of the next 6 months as well. So that's a start, but we are looking at what came forward here today in the federal package, which I would put forward was an effective package.
I have two questions, one of which is, I know it's impossible to do, but can you give a rough time frame as to how long the state of emergency is expected to last? And secondly, I'm getting communication basically saying the message is not getting out. So if we're in the middle of this state of emergency, what can government do more to get the message? I just got a text from someone basically saying that a Polytech Institute, they're still requiring doctor's notes to stay home. You're hearing all kinds of stories like that. At my own school, I still need notes to get my kid excused from classes.
Right. Well, we're doing our best with respect to this, holding news conferences virtually daily. Other provinces as well, and the federal government also holding news conferences daily. We have the very best medical advice also holding news conferences virtually daily in Saskatchewan and across the country. Our MLAs are going back to their constituencies in many cases, not cabinet. Cabinet is remaining behind to operate solely focused essentially on COVID-19. But our MLAs are going back to their constituencies now and they are picking up the phone and talking to people about the seriousness of this situation. And let me just say this and reiterate what Dr. Shahab had said a few minutes ago. If we are not able to flatten the curve, if we don't take these social distancing measures seriously, there is no health system in the world that will be able to manage what will occur. It is incumbent on us in this province to do our level best to ensure that we are able to flatten that curve and that our health system is able to handle what is going to happen over the course of the next number of weeks and the next number of months.
Can you ask the impossible question on the time frame, please?
Sure. It is an impossible question, but the order is put forward. It has a 14-day lifespan, and at that point in time, if it needs to be renewed, it will be.
Two-pronged question for Dr. Shahab. When you talk about community transmission, why the 50-person gathering limit? I mean, shouldn't it perhaps be smaller than that? Also, why, can you clarify why you don't consider a household contact to be community transmission?
Yeah.
Sorry, and three-pronged question. For close contacts, for contacts of people who've tested positive and are being contacted now, do they need to get tested, and why not?
So was the last one again? Sorry?
The people who have come in contact with those who have symptoms or have tested positive,
Okay.
do they need to be tested?
Okay, so I'll try to answer them, but I'll answer the first one first and then move back, but if I forget, then it's a five-pronged question, I think. But so if you're a close household contact and you keep your distance in the house, there's a good chance you won't get infected. So there's no reason to test, because if you're asymptomatic, the test is negative. And if you're fine after 14 days and the person who is your household member who had mild symptoms, they're fine, everyone's clear. So public health will give you the all clear. There's no reason to test. If you do get symptomatic, it could be COVID, it could be something else, so you are tested. If it's something else, you're still fine, you complete your 14 days. If it's COVID, you then continue for another 8-9 days till you've cleared, and then everyone is fine. So that's the best case outcome. So that was the last question. What is your?
Do people, I guess anyone, many people might be very concerned if they hear of anybody they've been in contact with symptoms who may have been linked to travel.
Yeah,
do they need, can they
about
get
the 50
tested?
people. I think I'll link it to the 50. 50 is not, there's nothing magical in 50. Last time, initially many jurisdictions in North America, Europe are using 250. But I'll tell you what I'm going to do. If I go into a meeting room and people aren't sitting 1 meter apart, I refuse to attend that meeting. And I actually will halt that meeting and ask everyone to move a meter apart. And if there's not enough room in that meeting room, everyone else can go to another room and we can dial in. If I'm invited to someone's house, I'll say how many people, Can we sit 2 meters apart? I'm not very popular right now, but I won't go if we can't sit 2 meters apart. And I don't want to go to a gathering with more than 4 or 5 people, actually. That's my comfort level right now. 50 is like a speed limit. Just because it is 50 doesn't mean that everyone needs to invite 49 people to their house. I think you need to minimize contact as much as humanly possible. 50 seems to be the right number right now, because, or up to 50% of your capacity. If there's a restaurant that can seat 30 people, they should actually have 15, because when in a restaurant, usually you're sitting pretty close apart, but if you keep every second seat empty and across the table, you usually have a 1 or 2 meter separation. So those are general guidelines, but I think that's how all of us should think. And then if you are elderly, have underlying risk factors, you need to be especially cautious of where you're going and not going. And as a visitor, you need to be very careful about visiting and keep that social distancing even when visiting.
So what about funerals?
Yeah, I mean, I think personally, I know I've heard reports where people are doing virtual funerals where really the immediate family member goes and the others can participate, virtually. It sounds a bit strange. I think, funerals, like the Premier said, weddings, those are all occasions to be together. Weddings can be delayed, funerals can't necessarily in every situation, but this is not the time to have close gatherings, whether it's, prayers, funerals, celebrations. Celebrations we can delay. Funerals, we should absolutely support our friends and family who are going through hard times, but support in a way that keeps them safe and keeps everyone else safe.
I know this is early days and you probably don't have a huge grasp on everything, but I think a lot of people are already kind of going stir crazy and wondering how long this can last, and restaurants having closed voluntarily, just jumping straight into closure without doing like the distancing of tables and stuff. I mean, you mentioned 8 to 12 months for vaccines and things like that. Can we expect to be locked up in our houses for 8 months, or?
So what we have seen from countries in Southeast Asia that did everything right is that 8 weeks, 12 weeks out, they have seen it come in a flat way, and then cautiously they can relax on some things but not other things, cautiously. So they may not open schools right away, they may not allow large events, but they can ease up on some of that, like restaurants and those kind of things. So I think, but we are only into the 10th week of this outbreak. We're in the middle of March. It's only been going around for 2.5 months in terms of, so we are looking back at people who did the right thing, 2 months back, and now they're at the other end, and they still have to sustain, but they can start, some things can start normalizing. But I think right now we need to sustain the next 8 weeks at least, and then reevaluate.
Yeah. Questions related to dentistry from a colleague in Saskatchewan. So will you be banning elective dental procedures and limiting emergency surgeries to a few select locations?
That's dental procedures.
Yeah.
Yeah, so I think, I'm aware of communication that the Saskatchewan College of Dentistry has sent out to its practitioners. I'm aware of similar letters that the colleges of dentistry have sent out in other provinces. And I think that it's really important because till such time you could safely self-isolate. If you had traveled from abroad or if you were at a conference, there was a conference where, not just dentists, but people who work in the dental profession had been in Vancouver, and there's at least 2, if not 3 people, one is a household corner, 2 people who have been impacted by that. So at the moment, if you were exposed, you obviously need to not go to work as a healthcare provider, whether it's dentist, physician, other provider. There's a good reason that as this starts transmitting locally, you have to think about what's the risk to you, what's the risk to your patient, what's the risk to your people sitting in the waiting room, based on what services you provide. So dentistry, we say that this is a virus that's transmitted to contact through nose, nose, eyes, and mouth. So dentistry is all about being inside someone's mouth. So obviously dentists are professionals. They have very high standards of infection control. the highest of all professionals. So they are actively looking at how can they continue to safely provide urgent care, how can they space out their patients. They need to have the same controls ERs and physician offices have, that someone shouldn't come even for a root canal if they're coughing. They need to have some pain relief till at least the fever's settled for a few days, but then they can provide emergent care with precautions. So urgent care obviously will need to be provided, but routine care should probably be, as this community transmission picks up, they should probably start scaling back as much as they can.
Why is it probably? Why aren't you, you could do probably, or you could do, here's what should happen.
Well, I think I've had certainly this discussion with the registrar of the College of Dentistry, and so this information has gone out. We're willing to work with them to see, I think I don't think it's appropriate to write orders for everything and everyone. I think as professionals, all of us can do a risk assessment for what's safe for us and our patients, and I think that's the spirit in which dentists, other people who provide personal care, not just in health but other services, have to make that risk assessment.
We have time for a few more questions. I've got Mark, Arthur, and Steph.
There's been some confusion with the self-assessment tool, people being told through it to go to ERs. What should people be doing if they have symptoms and want to get tested? And is there any plans to open more assessment sites?
So our tests have gone up significantly. I don't have the numbers, but they have gone up from 1,000 something to 1,800, 1,900. So tests are ramping up. They're happening all over the province. Our cases also are all over the province, north, rural, south, Regina, Saskatoon. I'll have to check. I've used it a few times, but it seems to work as designed right now. Obviously, we may need to tweak it a bit if we see a lot of community transmission, because at some point, and some provinces have already gone there, BC has already gone there, it's not effective if you have a lot of community transmission to test because you already know it's here. Then for mild illness, you stay put, you stay at home, you get over it, and that's it. We're not at that point yet. We do want to test. But then at some point, you have to say, okay, we'll test people who are still coming back after travel, but we know that's going to dry up very quickly in a week or two. And we want to focus on testing people who are seriously ill and who work in essential services, healthcare workers. They can't self-isolate every time they're in contact with the case because but as long as they're using proper precautions, they don't have to self-isolate because they're not considered exposed. But if there's an issue, if they have a cough, a fever, they can stay at home, they can get tested. If it's cleared and the fever settles, they can go back to work. If it's COVID-19, they have to stay home for 8-9 days, maybe not the full 14 days because we're learning more and more. And then they can be cleared, tested again, and go back to work a bit early if they've cleared the virus. So that's the approach we'll have to take going forward. But we will have to adjust our approach.
First question for the Premier. I wanted to ask you about the powers that are made available to you under the state of emergency, and particularly the power to limit travel to or from a community or region. Under what circumstances would you make use of that power? And particularly now, given that there is evidence that there may be community transition, are you considering any particular regions or communities? And what would that mean if you did make use of it for people's day-to-day lives?
So there's a number of things that one would use this act and this power for. And let me be clear, it was my sincere hope that we don't use it and don't use it once. But you could use it, for example, to set the price of certain items. You could use it, for example, to set the volumes of purchases that could be available for certain items to an individual. Or you could use it to isolate a portion of a building, a community, or an entire town, village, or city. Anywhere in the province. And so now as we are looking like we have a number of new cases and the potential for possible community transmission, of which I think we will get to at some point if this particular case is not that, we're not going to eliminate COVID-19 from being exposed to the people of the province. What we want to do is slow down the rate at which it is exposed, which people of Saskatchewan are exposed to, or flatten the curve, if you will. So that's precisely how we would be viewed as using this, is if we need to move in very quickly to do something just like that, to to isolate a portion of a community or an entire community. So we don't have anywhere in mind where we would use it immediately, but we think it needs to be available to act very quickly in what is an increasingly volatile situation.
And I'm not sure who would take this question, but I'm hearing very specific reports about swab shortages. For instance, in the former Five Hills Health Region, in Assiniboia, potentially in other areas. Can you confirm whether or not that's the case? Give us an update on how many swabs are available and whether they're sufficient to meet the expected demand. And further, explain whether that's had any impact whatsoever on the guidelines being used to determine when testing is done.
I'll answer at a very high level, and then I'll ask either of you if you'd like to go into any specifics that you might have information on. And I don't have information on the specifics, but with respect to supplies, whether it's testing supplies or personal protective equipment supplies, we were on a call again this morning with the premiers and the prime minister discussing just this. We are actively have orders in for a number of not only swabs and different types of swabs, but also a number of different types of personal protective equipment as well. And we're working actively with other provinces and the federal government to ensure we can find that supply. We're also hunting out and about on our own as well, to looking for additional supply as well, as these are items that the rest of the world is looking for at this very same time. So I'm not aware of any shortages at the moment with respect to any of the items that we need, and I'm not aware that it has in any way impacted the number of tests that we're doing in the case of swabs. In fact, Dr. Shahab had just referenced we did more tests in the last 24 hours than we have at any point in time thus far, and it's our expectation that will continue to increase. So in saying that, we continue to look for not only for supply of the swabs we have, but additional kinds as well. So either of you have anything to add to that?
I'll just make a comment and then let Dr. Shahab. I was at a ministry briefing yesterday where we discussed supplies and specific to swabs. I was told at that time, I forget exactly how many days, but we had like a number of days left of the supply that they had been using. They're expecting another significant supply in by the end of the week. And in the eventuality that for some reason, although they fully expect that order to arrive, if it doesn't, they have a significant number of a different type of swab. As they described it to me, it's not. It can absolutely be used. The lab prefers the other type somehow for ease of use, but I took great comfort out of that briefing.
Yeah, I think I haven't heard about this particular instance, but as testing ramps up, there's a bit of supply pressures that then you have to redistribute. So far, we're doing okay, but at some point, we do need to revisit how we test, and maybe in the future sometime, we would not recommend testing for mild illness because we're already learning now that, and in fact, there was a scientific paper I read yesterday that we discussed at our FPT table where the good news is that the majority of people, more than 80%, have a mild self-limited illness and they cleared the virus in 8 to 9 days. They're actually free of the virus on day 10. We still require them to isolate for 2 weeks, but actually by day 10, they're clear of the virus. So that's the good news. So previously, everyone had to be tested negative at the end. Now that is actually not the recommendation now for mild illness. So, we're trying to rationalize the testing as much as we can as well.
Last question, Steph.
You mentioned that community transmission is suspected or is happening when an infected person from traveling goes home and obviously spends time with their loved ones. Are you considering some kind of order or option where people who are self-isolated have to go somewhere completely alone? They're not allowed to say go back home to be with their family or roommates or whatever it may be. And if that option's on the table, how would that actually work?
Yeah. So first of all, we don't have any evidence of community transmission at this point, but we expect it to happen. In the instances in Saskatchewan and in many parts of Canada, the way people who are symptomatic self-isolate at home, clear instruction is given to them, and there's been very few cases of secondary transmission in the whole household setting. We have just seen one instance, and that may have been a common exposure while traveling to another province. but we have not seen any evidence of secondary household transmission. It means that people are able to self-isolate even within the household. By community transmission, we mean that someone shows up in ER and they have not traveled anywhere, they were not in contact with the person who was sick, or you get an outbreak in a long-term care facility where no one visited the long-term care facility who was sick and had just traveled from abroad. So then you can't find where it came from. So that's when we say it's community transmission. We still try to search for the source, but if we can't find anything in a few days, we say community transmission is here. It may only be in a part of the province, but all the steps we've taken is exactly to delay those eventualities. Don't visit long-term care if you've come from another province unless for compassionate reasons, and then just go and visit the person you have to. Don't visit hospitals. Absolutely don't visit people who are vulnerable in home or a facility, even if you have a cough and you think you're fine, it's just a cough. Those are essential precautions now going forwards.
Are you going through Sask Alerts? It seems a little bit better than Twitter feeds or Facebook or anything else for mass communication.
Oh, for like we do, yeah. That's an option. We haven't done it as of yet. That is an option though, because there are some, in the vein of taking this very seriously. We must remember that it quite likely isn't someone of my age, and not that I'm overly healthy, but I feel pretty good. I'm likely going to have mild symptoms as the data shows. But my parents are at a higher risk category. And so the danger is not directly to me, it's to my parents and their generation, and it's to those individuals in our retirement communities and in our long-term care facilities, and where we are seeing terrible results, fatal results in Canada are in our long-term care facilities. And we need to be very, very diligent, not only in our personal distancing, but I would ask the people of this province to be very diligent in whether or not they need to visit a long-term care facility or visit anyone in our community that would be considered at a decreased immunity or considered vulnerable to this virus. This is where we need to keep it out of.
Thanks very much, everyone. That's all the
Can I
time we
just
have
ask
today.
if we're gonna continue these, given social distancing?
I can address that after.
Okay.
We're just going to take a minute to reset, and then we'll have the premier back out here.
Cool.
We'll just refill your water and stuff.
I'll be right back, I suppose.